Hi, my name is Evanie. I'm a student at the College of Central Florida, and today I'm going to be doing trach care. Before I go in the patient's room, I've already checked the doctor's orders, and I'm going to go ahead and knock on the door. Knock, knock. I'm going to go ahead and go in. Before I touch the patient, I'm going to go ahead and wash my hands. Hi, Mrs. Jones. My name is Evanie. I'm your student nurse for today, and I'm here to provide trach care. I'm going to go ahead and check her name and date of birth on her band. If she's able to tell me her name and date of birth, I would ask her and make sure it matches, but I'm going to check it against my physician's order, which it matches. So I'm going to go ahead and explain the procedure to Mrs. Jones. Mrs. Jones, today I'm going to be doing trach care, which means I'm going to be taking your inner cannula out. I'm going to be cleaning it. I'm going to change your dressing, and I'm going to change your neck ties, okay? And during this procedure, if you have any distress, I want you to lift this hand right here. And before I start the procedure, I'm going to go ahead and do a respiratory assessment just to make sure she's not in any kind of respiratory distress. Her respirations are good. I listened to her lung sounds. She doesn't have any crackles or wheezing going on. O2 sats are good. And she's not having any respiratory problems. So it's okay for me to go ahead and start this procedure. So I'm going to go ahead and let the bed up. I'm going to let the side rail down. Ms. Jones, I'm going to move this pillow, okay, just in case I need you to hyperextend your neck. Okay, I moved the pillow. Once I got that done, I'm going to go ahead and wash my hands before I start with my supplies. And I got a trash can over here. I'm just going to put it closer to me. Wash my hands again because I just touched the bed. Okay. Here I have my normal saline. I checked the expiration date. It's not open, so it's fine. Once I open, I'm going to date, initial, and time it, so the next person knows that it's good for 24 hours and they can use it. And also my hydrogen peroxide, I'm going to do the same thing. Once it's open, I've checked the expiration date. It's fine. I'm going to go ahead and provide for privacy. I'm going to close the curtains. And I would have on PPE for this skill, but for the purposes of the video, I'm not going to have it on. I'm going to go ahead and put my gloves on. These are just clean gloves. I'm just going to put it on. And I'm going to go ahead and put this chuck on the patient just to preserve her clothing. Okay. And I'm going to go ahead and take the oxygen. I'm just going to move it to the side, but I'm going to keep it close so she can get some kind of oxygen coming. I'm going to go ahead and remove the old dressing. I'm going to assess for coca, the color, the odor, the consistency, and the amount of drainage, and I'm going to document that. And I'm going to go ahead and discard this. I'm going to go ahead and wash my hands again. And go ahead and get my sterile stuff out. Okay. I'm gonna go ahead and get the drink and its shiny side down. This is how it goes. Right now I'm touching the shiny side. And I have a 1-inch border here. Okay. Now I'm going to go ahead and take my supplies and dump them onto my sterile field here. Gonna go ahead and pour my peroxide in one container and my saline in the other. Now I'm gonna go ahead and dye my sterile gloves. I'm not gonna leave it again. Okay. Okay. First, I'm going to go ahead and grab one of my sterile gloves here. Okay, I have my sterile gloves on now. And I'm going to go ahead and take my Q-tips. Well, I can set up my little field here first. Just make sure everything's how I want it. And I'm going to take my Q-tips here. And I'm going to sit one in the peroxide and one in the saline. Okay. Once I have that done, I can go ahead and remove the inner cannula with my non-dominant hand. Okay. Once I have that removed, I'm going to take my peroxide here, take my Q-tip out of my peroxide, and sit my inner cannula in it. I'm going to take my peroxide here and I'm going to clean around the the stoma. Okay, once that's done, I'm going to throw that in the trash. Then I'm going to get my saline one with my non-sterile hand, which is here. No, I'm going to get it with my sterile hand. Hold on. My sterile hand. So I use my non-dominant hand to maneuver this. And I'm just going to clean around wherever I put the peroxide. Okay, and I'm going to throw this in the trash. Okay, I'm going to pick up the inner cannula with my non-dominant hand. I'm going to take it out of the peroxide. I'm going to get the pipe cleaner here with my sterile hand. And I'm just going to step back from my sterile field over the trash can and clean it. And that can go in the trash. Then I'm going to go ahead and squish this around in the normal saline. Okay. Okay, I got it out the normal saline. I'm going to go ahead and take one of my sterile gauze here so I can dry it. Okay. And then I would take one of my things here and dry the inside. Okay. Now, I'm going to go ahead and put this back in. Take another sterile gauze. And I'm going to put this back in with my sterile hand now, since now it's clean. And once I cleaned it, okay, I'm going to put it in at 9 o'clock and go twist until 6 o'clock until I feel a click, which I just heard. Okay, once that is done, I'm going to go ahead and put the new dressing on. So I'm going to grab, with my sterile hand, I'm going to grab these. And I'm going to grab the gauze. And wait a minute. My sterile hand, I'm going to grab these, and then I'm going to switch these to my non-dominant hand. And I'm going to grab the other side of my gauze with my sterile hand. Okay, the important part is just keep making sure that the part that's split is as sterile as you can keep it. Let's see. Just gonna try to get it up there the best I can. Grab it from the top and pull it. Okay. Now that I have the dressing on, I'm gonna go ahead and put the ties on. But for the sake of this video, I'm not gonna be actually doing the ties. But I would not remove the old ties first. I would go ahead and put my new ties on while the old ties are still on. I would make sure I have 1 to 2 fingers with between the patient and the tie. And when I tie in the front, I'm going to tie as closest to the front as I can and stay away from the carotid artery. And once that's on, I will go ahead and put the oxygen back on the patient. And then I will go ahead and clean up. Mrs. Jones, are you okay? Okay, she said yes, she is. I will go ahead and just assess her respiratory again, just to make sure she's not having any respiratory distress. Check her respirations, her O2 stats, and make sure that she's doing okay after the procedure. Gonna go ahead and put my rails up. I'm gonna lower the bed. Miss Jones, do you need anything before I leave out? No? Okay. I'm gonna make sure she has a call light. Here's your call light. If you need anything, please let me know. I'm gonna clean up all my stuff here, but for the purpose of the video, I'm gonna leave it there. And I'm gonna go ahead and wash my hands before I leave out. I forgot to put your pillow here, Miss Jones. Let me put your pillow back. Okay, wash my hands. I'm gonna pull the curtain back, and I'll be sure to go ahead and document my assessment and how the patient tolerated the procedure.